Mulla Exercise and Education Program, a local physiotherapy delivered community health initiative.
We would like to acknowledge the Wiradjuri and Biripi people who are the traditional custodians of the land. We would also like to pay respect to the elders, both past and present, of the Wiradjuri and Biripi Nation, and extend that respect to other Indigenous Australians who are present.
Mulla is situated in the central west of New South Wales, a small rural town with a population of 2,284. They live in 1,594 private dwellings with an average household size of 2. Overall, 14.7% of the population are aged between 0 and 14, and 27.9% are aged over 65. 512 people within the population identify as Aboriginal or Torres Strait Islander, with 65% of the population aged over 45 suffer from heart-related conditions, and 73% of the population are not undergoing the recommended amount of physical activity. Today we'll be conducting a needs assessment to get some information for our education and exercise program for Mulla. This will incorporate an interview with our 45-year-old male who is Indigenous and the rugby coach for the local team. Okay. Hi Zach, how are you today?
Good, thank you.
Do you mind if we ask you a few questions?
Go for it.
Alright, do you have much of an understanding of your heart condition?
No, not really. I just know that I can't do too much because, it's not good for my heart.
Alright, so that's not necessarily true, so we'll have to go over that in our program, but that's okay. Do you have any mates with a similar condition to yourself?
Yeah, I've got 3 mates that I used to play footy with. They don't know too much about it either, but yeah. 2 of them stopped playing footy because of it.
Do you guys talk about your condition much?
No, never.
Alright. Do you think that the older population or the younger population are more diagnosed with heart conditions?
Definitely the older.
Definitely older?
Even though I'm pretty young.
Why do you think the older?
Because they have old hearts.
Okay. Are you physically active, Zach?
No. No.
No?
I'm not.
Alright.
I go to footy training twice a week, but I just tell the boys what they're meant to do. I don't really partake.
Do you know how often you should be exercising?
Probably at least once a day, but I don't know how much.
You don't know for how long?
No.
Alright, that's something else you'll learn in our program. Do you know what the risks are if you don't exercise?
Well, I thought too much exercise was bad because I've got a bad heart.
Definitely not true. But you'll also learn about that in our program.
Okay.
How much do you think physical inactivity is costing our government each year?
Probably not much. I don't see why the government pays for us not being active.
Well, according to the 2017 government overview, it was costing us $1.5 million per year.
Wow.
Is that a shock?
That is a shock.
Right. Are there any exercise programs within your community?
Just the footy team that I know of.
Yeah.
I don't know, we don't even have a gym.
Don't even have a gym?
No.
Do you think if there was a social aspect to physical activity, you and the community will be more involved?
Well, that's the only reason that we used to play footy.
Yeah, for the social aspect.
Yeah.
Do you eat enough fruit and vegetables?
Do you want the truth?
Yep.
No. No, I don't.
Do you eat
I eat a banana every day, but
every day?
yeah.
Is that all you eat?
Yeah. That's about it for veggies.
Would you like to know more information about your condition, nutrition, benefits of exercise, and have more contacts with medical staff of your town?
Absolutely. I think that'd help a lot.
So an overview of the conditions we'll be addressing. The main condition is cardiovascular disease. So 65% of the local community aged 45 and over suffer from heart-related conditions in the Mulla area. On top of this, CVD accounts for the highest prevalence of mortality and contributes to about 17% of the burden of disease for Indigenous Australian population. In 2015, coronary heart disease was the leading cause of death across Australia, with mortality rates 1.3 times greater in remote and very remote areas, such as Mulla. Following on from this is diabetes and obesity, which will be addressed subsequently to the exercise and nutrition. So people living in remote and very remote areas were 2.3 times more likely to die from diabetes compared to those in major cities. On top of this, Indigenous Australian population are 4 times more likely to suffer from diabetes than non-Indigenous Australians. 69% of people living in regional and remote areas are overweight or obese, and in particular in Mulla, 73% of the population are not undergoing the recommended amount of physical activity. And the last condition that we'll be addressing is mental health. So studies have been shown a strong link between chronic disease/illness and the prevalence of mental health issues. Suicide rates are 1.7 times greater in the remote and very remote areas as compared to major cities. Indigenous Australians are up to 3 times more likely to experience high psychological distress when compared to non-Indigenous.
Zach, I just had a further question. What do you think some of the barriers are in your community for someone like yourself to access healthcare?
Probably money, I'd say. I feel as though it costs a lot to go see a doctor constantly.
Okay.
And even to eat healthy, I just find it's easier to go and buy fast food just because it's so much cheaper.
Okay.
Yeah.
Anything else?
Maybe like getting there. I don't know how I'd get to a doctor half the time, just because my wife, she takes a car to work, and that's the only car that we have.
Yeah.
Yeah.
Has there ever been an issue with your rugby team getting equipment to play?
Yeah, we use a lot of old equipment, which, yeah, we just don't have very much equipment, really.
Do you feel like the doctors in town sort of understand you culturally as an Aboriginal man?
Not always, no. I'd say they don't really take into account our views and beliefs as much. It'd probably help if maybe there was an Indigenous worker there, maybe, just so I felt a bit more safe in the environment.
Okay, thank you. Okay, we'd just like to get a reflection from one of the physios about some of the barriers you might feel that you face in this situation. Do you feel that there's any barriers around you being a new physio in this situation?
Yes, I think being a new physio, I still have a lot to learn, and there's not a lot of support from other physios in the area. I find that I do have to do a lot of my own research and my own study on things, and it's difficult to have like a mentor in this location of Mulla Mulla.
Okay, touching on the location, any aspect of being so rural that you feel is a barrier?
Yes, accessing Mulla Mulla is quite difficult. I had to learn how to drive a four-wheel drive. I didn't know how to do that before. Also, accessing other health services in the area is quite difficult. So other allied health services are hundreds of kilometres away.
Okay, and finally, do you feel that being new in a town makes it difficult to reach out to certain people that might be able to help you, like some of the stakeholders that you might look to find in the town?
I do. It takes a while to develop professional relationships and to develop the relationships you need to build good healthcare services. Additionally, in not only building those relationships, but you also want to build a relationship with the Indigenous population as well.
Have you had any experience in the past with predominantly Aboriginal and Torres Strait Islander populations?
No, I have not. We did touch on it at university, but being a new physiotherapist, it's something that's a new experience for me.
Okay, thank you. Now, based on what Zach has said, what do you believe are some of the enablers to a successfully implemented and carried out health program?
I think the main thing primarily coming in as a new physio is I'm here with high motivation. I really want to implement this program and I want to help the community. Also, we're looking into a funding model. We've got grants from New South Wales Health and Sarah. These grants will help us deliver a free program for the Indigenous Australians in Mulla Mulla. So additionally, we also will be implementing a free community transport bus to help the Mulla Mulla residents be able to come to the health appointments, come to the sports events and access their education. Additionally, we want to make this a socially and culturally acceptable program. Therefore, we were going to incorporate the use of an Aboriginal health worker and also consult the elders within the town to make it as socially acceptable as possible.
Here we have introduced some strategies which we will implement to address some of the issues raised by Zach in the previous interview. Number one is making sure the program is free. The second, providing transport for the participants. Number three, making sure it's in a familiar location. Number 4, providing online resources. This will play into the diet journal that we're going to provide our participants, as well as general health information. And number 5, using the Indigenous health services already present in the area, such as the Aboriginal Liaison Officer. This is to hopefully promote acceptability. Here we look at strategy 1 in more detail. We've made sure that our reasoning behind making it free for the participants is evidence-based. Funding for this health program is required to be delivered at no cost to the public of Mulla, as, quote, it is demonstrated that poorer people have less financial and other forms of control over their lives. Further to this, a free program will increase accessibility for all community members in Mulla, particularly the most financially marginalised, as 22.3% of the town are unemployed or away from work. Further to this again, as we are targeting Mulla Indigenous people for healthcare, it must be delivered as a free service, as the average gross household income for Indigenous Australians is 62% of the non-Indigenous peoples. Our second strategy is a transport service. Now, the reasons for the transport service are quite varied in benefits, and they include it increases accessibility and availability of the healthcare within the community program. Secondly, it promotes the health service to the community through banner advertising across the paint of the vehicle, which will include office phone numbers, website, and a program slogan. Offer of employment to 1 to 2 local Aboriginal and Torres Strait Islander community members to operate the service should go some way to improving the cultural safety of the service and improve community buy-in.
The next strategy we have utilised is using a familiar location. It is important that we find out what land or nations our communities have connections with. Indigenous community members are connected to family, their culture and the land before they are even born. So it is important for us as the educators that we develop relationships within the community and discuss what land or nation the community is connected to. We feel this will create a greater sense of belonging and acceptability for those involved in our program.
The fourth strategy we'll be using is the implementation and utilisation of online resources to improve the quality of health services for Indigenous Australians residing in Mulla. For example, using online journaling, provision of education and access to healthcare providers. We're additionally aiming to create a supportive online community via utilisation of social media, including Facebook for health promotion and delivery of education. A systematic review determined that social media use in young Indigenous Australians can enhance cultural identity, community and family connections, which are linked to improve educational and health outcomes. Internet-based technologies may bridge a gap between Indigenous and non-Indigenous Australians, as when literacy and numeracy skills are lacking, Indigenous Australians can still have a solid grasp of technology, even despite ownership of a computer or not. We hope that those that don't have access to the internet or a computer will utilise these for free at the local Mulla library.
The fifth strategy we'll be using is the utilisation of Indigenous health services to increase the acceptability and quality of health care service. Aboriginal and Torres Strait Islander people are generally less likely to use preventative healthcare services in comparison to non-Indigenous Australians. Research has highlighted through creating a welcoming, safe environment, building healthy relationships, and utilising the presence of Indigenous staff, we as health professionals can improve the acceptability and quality of health services within the Indigenous Australian population. Over the past 14 years, the episodes of healthcare provided for Indigenous health services tripled from 1.2 million in 1999 to 2000 to 3.5 million in 2013-14. In 2014-15, over 5 million contacts of care were provided to 434,600 clients over 203 Indigenous healthcare services. Of these clients, 79% identified as Indigenous Australians. Through the utilisation of local Indigenous health service, for contacts including GP checkups and counselling, we're able to both improve the acceptability and quality of healthcare service to the Mulla community.
It is going to be hard to implement this program in a successful way if we just try and start it without any preparation work beforehand. That's why it is our plan to liaise with the local ALO, Sarah. She's been part of the community for the last 20 years. She knows everyone and who has the most influence on the community. We will then work with Sarah to get to know the elders of Mulla and get to know them on a personal level, and once we have their trust, we will start to introduce them to our exercise and education program. If we can work in a collaborative partnership, the spreading of knowledge will be easier to implement our program. We will organise a community event. This will be like a taster day for our program and will give the community an idea of what will be involved. Over the course of the day, we'll hold taster exercise events such as different types of team sports as well as elements of our circuit program. We hope that this will help emphasise how easy it is to be active. The day will also include a brief education session on CBD and why exercise is beneficial, especially for those suffering from chronic disease. We'd also like to get the local GPs and health professionals such as dietitians and pharmacists involved on the day so that they can get their name out into the community, especially as they will be running some of the education sessions throughout the program. Lastly, we'll be providing a free healthy lunch on the day to help introduce healthy eating habits. Physical activity has been continually linked to positive outcomes, especially for those suffering cardiovascular disease, mental health problems, type 2 diabetes, and obesity. With 73% of the population of Mulla indicating they are physically inactive and 65% of the population over 45 diagnosed with CBD, we think it is time Mulla has an exercise program put in place, and that is why we are here. According to the Australian Institute of Health and Welfare in 2017, physical inactivity is responsible for 10 to 20% of disease burden for related chronic diseases. We want to start running a 3-month program with constant rotations open to all ages with the aim to reduce CBD risk and prevent the disease, as well as help fight the lack of exercise the community is undergoing. We want to include a range of exercise types to try and engage all ages and fitness levels. This will include things from circuit type programs all the way up to team sports. We want this to be as beneficial for both the community and us as physiotherapists. Therefore, we will help make goals with the participants and test for improvement all the way through with outcome measures. The exercise sessions will be run at either the community centre or a local school oval, depending on the facilities that are needed on the day. In 2017, the Australian Institute of Health and Welfare's research showed that even just 15 minutes of brisk walking 5 times a week can reduce disease burden by up to 13%. However, we want more. We want the exercise program to run 4 days a week with 1-hour sessions. A group will consist of 10 people and each group will come twice a week. The first 40 participants will have the highest CBD profiles within the community, so they can spread the word and we can eventually get the whole community involved in some way. Participation will be referral based from either GPs or the local Aboriginal liaison worker. We believe that even word of mouth from the community elders will help us gain numbers from the community.
The education sessions incorporated in our program will run every Monday night. They will include, firstly, an initial assessment where participants' BMI 6-minute walk tests will be measured. They will complete questionnaires about exercise, eating habits, and knowledge of their health conditions. This session aims to determine the level at which participants are currently functioning. Information will then be provided on chronic diseases, particularly cardiovascular disease, and its prevalence in the Indigenous population. Education on nutrition will also occur. This will include 2 sessions which will provide education on healthy food options, the benefits of good nutrition, and how to use a food diary. The GP will run an education session on mental health and the importance of regular GP consultations. Physiotherapists will present information on the benefits of exercise in relation to chronic diseases we are targeting, including mental health, diabetes, obesity, and cardiovascular disease. The local pharmacist will present an information session on medications, and participants will be able to ask questions about their particular medications. A nutritionist will run 3 cooking sessions, showing how to prepare and cook an example of a healthy breakfast, lunch, and dinner. The last session will be used to complete the final assessment to determine the improved health outcomes for participants. Sarah will help run this session. There will also be a party afterwards where healthy treats will be provided and all the participants can invite their friends and family.
Okay, Andrew, so why do you think physiotherapy is primarily involved in this program over other allied health workers?
I think as a physiotherapist, and especially as a new physiotherapist, we're provided with tools to ensure our clients receive preventative healthcare as well as a more reactive approach. Secondly, I believe we're given some skills to encourage good health outcomes for Aboriginal and Torres Strait Islander Australians. And in the Mulla community especially, I believe there's most likely a high demand on the single GP in town. And so I think as a physiotherapist we can bring about less pressure for them. Additionally, the Mulla population experience a lot of chronic disease, and as physiotherapists I believe we are experts in chronic disease management. And finally, as physiotherapists we have a wide variety of tools that we can implement in the assessment and management of cardiac issues like CVD. A health promotion of any size will require some level of evaluation. However, one that spans almost an entire community will require highly detailed and specific evaluations. Beginning the evaluation process at the end of the project can lead to many unforeseen difficulties around costs of time and money, as directions and statistics obtained during an evaluation can take months to collate. This is why our evaluation begins as soon as the program objectives are chosen. This slide describes some of the conditions upon which our evaluation has been made. This health program intends to change the behaviours and health outcomes, and so evaluation must measure this change at a community level. Evaluation will predominantly be a pre- and post-study test, with participants answering the same questions before and after completing the program. The chosen evaluation tools and questions must be culturally safe for the Aboriginal and Torres Strait Islander peoples of the community. And finally, and most importantly, prior to the evaluation process, the proposed method of evaluation, i.e. interviews or group forums, and the survey questions themselves are discussed with key community members. This input from the program stakeholders means that the evaluation process can be refined to better represent the culture, spirituality, and the priorities of the community. Okay, Zach, we're 1 year after you've finished your program. I just had a few questions here to basically get an understanding of how your life and health behaviours have changed since finishing. Okay. Do you believe you are healthier because of participating in the health program?
Absolutely.
Yeah.
100%. Yeah.
What parts of the program did you participate in? So there were exercise classes, cooking classes, nutrition, shopping education, and group sports.
Yeah. I definitely got involved in the exercise class.
Yep.
I didn't realise how much I really needed the diet help until I started doing the cooking classes and the shopping classes.
Yep.
And I found they really helped.
Okay. Were you able to access the program features you wanted?
Yeah. I found the online tool really helpful.
Yep.
I know that not everyone has access to internet, but I do. And I really found the transport to and from the exercise classes really helped, especially because, as I mentioned before, my wife has the car and takes it to work.
Okay. What aspects of the program have you continued to do since completing it?
Exercise. I go for a half-hour walk every day.
Yep.
And just try and generally eat a lot cleaner than I originally did.
Okay.
Including, more fruit and veg.
And you mentioned the group sports. You're still involved with the rugby team?
Yeah, still with the rugby team. I actually do a bit of training myself now with the boys rather than just sitting on the sidelines.
What were your favourite parts of the health program?
I think definitely the cooking classes. They were fun, engaging, and really gave me an extra option than just going to get take out all the time.
Okay. Was the program delivered in a way which you believe was culturally appropriate for you?
Yeah, I really liked the use of the Aboriginal elders and the health worker.
Yep.
Getting them involved really made it feel like a safe environment.
Okay. And the last one, Do you think you need additional assistance in improving your health going forward?
Yeah, I guess I could always improve.
Yeah.
But I feel as though I've got the general tools now that I can stay on a healthy path.
Okay. Thank you, Zach.
Thank you.
The Year 1 evaluation of Zach that you just watched is an example of how changes can happen within several months or a year in an individual. However, because this health program is attempting to change the Mulla community at large, we are devoting the Year 3 evaluation to assessing whether the community changes have occurred or not. In the simplest terms, the Year 3 evaluation is an assessment of how far our reach has gone within the Mulla community by assessing with quantitative data a measurement of the participation across the Mulla community in our health program. The way we do this is through computer-assisted telephone surveys, postal surveys, and the provision of survey forms to go out to local sporting groups and community centres. We use this methodology to ascertain the proportion of the target population, that is, people with CVD or at risk of CVD, who have taken part in any portion of our program, that being the exercise program, education classes, etc. This will give us some indication as to the level of community engagement that we have enjoyed during the running of our program. At Year 5, evaluation needs to shift into a program viability scope. It will need to look at the financial viability, looking at expenditure versus the social benefit, and the review of the program strategy implementation, i.e. updated community needs assessment will need to be done to direct necessary changes in how the program is delivered to Mulla over the next 5 years. Some things that we can bring into clarity: can the local population further develop control over the direction of the project? And finally, assessment of the health workers needs to be done, which should involve the rate of staff turnover, staff satisfaction levels, and participant review of staff performance.
In order to ensure the free service delivery of our program, we will be utilising numerous forms of funding. Organisations such as Sarah provide grants to organisations and programs focused on addressing health gaps within rural and remote areas of Australia. Australian government initiatives, including Closing the Gap and the Indigenous Australian Health Program, look to provide funding to programs focused on closing the gap between Indigenous and non-Indigenous health through addressing chronic health conditions such as CVD and diabetes. Medicare is an Australian government initiative that looks to subsidise or eliminate all costs associated with primary health care, increasing the access for the Mulla community. Our initial funding model looks at first year cost, including the purchase of our minibus for transport, the start-up of our community garden, and initial purchase of office resources and program equipment. Funding from Sarah and the Indigenous Australian Health Program will go towards the purchase and upkeep of our transport bus, covering the wage for our driver and fuel, as well as funding any equipment or office resources required initially. New South Wales Health will pay a salary for both the dietitian and physiotherapist, as well as providing the funding for our healthy eating cookbook. Our community garden will be donated by the local community using existing funding streams. Any cost associated with the GP and pharmacist will be covered by Medicare. Following the first year of our program, we will have to re-evaluate our funding model, taking into account we will only require funding to maintain the bus and equipment we already own.
A critical commentary of this health program can highlight some limitations. Specifically, the rurality and limited technologies in Mulla may restrict the accessibility for the social media aspects of the health program. Secondly, the program is limited in accessibility for European background non-English speakers. And due to the newly coming into the Mulla community, the services provided by an outsider are at risk of being culturally inappropriate. And finally, there may be some limitations in the ongoing funding of the program. However, with accurate and comprehensive evaluation, which can be presented to funding boards, this may bring about financial security for the implementation of the program going forward.
To appropriately implement our health service delivery program, we need to be aware of the risks involved and how to manage them. Risks will include cultural risks, such as not supplying culturally appropriate healthcare services, and Mulla Indigenous Australians not participating or being compliant with the program. Management for these will include engaging in cross-cultural training to increase cultural safety and competence. We must build a rapport with the Mulla community and individual participants. Additionally, we will liaise with Aboriginal health workers and elders to ensure the delivery of a more culturally appropriate service. Further risks will include the physiotherapists potentially leaving town. This would take time to replace them and leave a large gap in the health service delivery for Mulla community. Also, the physiotherapy is at the risk of working outside of their scope of practice, being a new graduate in a rural location. Management for these will include taking university students for clinical placements to increase knowledge of Mulla, social media presenting at a rural health conference, and having education packages on Mulla for new physiotherapists. The physiotherapists must also ensure that they are aware of their clinical competencies and limitations and seek help and education when necessary. There is also a risk in the environment, and the use of transport could impact on this. We must ensure that the driver and the bus are both insured and the bus is serviced regularly. There also is the potential of the risk of alienating existing healthcare workers in the Mulla community. We must ensure the inclusion and collaboration of existing healthcare workers, for example, the GP and the Aboriginal healthcare worker, Sarah.
This concludes the Mulla Health Promotion Program presentation. Thank you for listening.